Good morning, everybody. This is Alicia with DentiMax. I hope you all are doing well. I'm going to go ahead and get ready to start in just a minute here for our webinar today. I'm going to be covering how to post charges from the chart screen and also from the scheduler. Depending on your office, one way might make more sense versus the other. I'm also going to cover how to customize the chart screen and also charting in general. So I am recording this video. If anyone would like to request a copy afterward, as usual, feel free to email me directly at Alicia, A-L-I-C-I-A, @dentmax.com, and I'll be happy to send you sometime probably early next week after I have a chance to edit out all of my ums. So hope everyone's okay. We're just going to hang out just one more minute, and then we'll go ahead and get started. Okay, let's go ahead and get started. So thanks again for joining me. I really appreciate those of you who do get on and have questions and thoughtful insight for us. It's always appreciated, and I'm happy that we're able to provide some sort of free training for everybody that we could kind of take care of stuff you might not have thought to ask before. Maybe you're further advanced in the software than when you started, hopefully. And maybe you haven't been dealing with the charting screen yet. And so this is a great opportunity for you guys to learn more information at no cost to you. I'm going to go ahead and get started by going to my scheduler, and the initial posting we're going to do from the schedule. So we've got a couple patients here on our scheduler, and those are the two we're going to focus on today. We've got Channing Tatum and Sandra Bullock. And Channing, we're going to go ahead and post his charges from the schedule, assuming that the back office already did all of their work and went ahead and charted his future treatment plan, existing restorations, and then they hand off the patient to the front and say, this is what we've accomplished for the patient today. So I'm going to simply select his appointment with a single left click. We know this appointment is selected because we have the blue halo around his appointment. And then I'm going to right click anywhere on the screen, go down to change status, and mark his appointment complete. We did have him planned today to do a comp exam, prophy, 4 bite wings, pano, and oral hygiene instruction. And so if that's not what was done, you can double click and change it on the schedule if you'd like to, or you can wait till you get to the complete section and then you can change it in this next screen. And actually, I just want to take a step back for one moment. I'm going to discard this before I post anything. I do want to show you under change status next to complete, there is a hotkey of F2. So instead of doing the whole right click and then change status and then go to complete, just click on the appointment and hit the F2 hotkey on your keyboard, and it accomplishes the same thing. So if you are posting charges from the schedule, that is the quickest way to do it. So I'm going to go ahead and click complete once again, and it takes us to post our appointment transactions. That's the screen that we're in. Once you get to this moment, you do have the opportunity to go to your options menu and either edit a transaction, add another transaction, or delete a transaction. Please keep in mind, if you choose to delete a transaction from here, it does delete it from the treatment plan altogether. Okay, so if you don't want to delete it from the treatment plan, just don't post it. And so it still will be in that patient's treatment plan for their next visit or any subsequent visit. If I want to edit a transaction, let's say the bite wings. Perhaps we did an FMX instead of bite wings and a pano. I simply select that item so it's blue. Again, blue is showing you've chosen that thing to work with. Go to my options menu and hit edit transaction. And then here, I'm just going to change it from the D0274 to the D0210, which is our FMX code, and then save my changes. Now we've got an FMX, and I need to delete the pano. So I'm going to click that item so it's blue, and hit delete transaction, because we probably won't be needing to do that in the future since we've completed our FMX. So now I've cleaned up what we've actually done today, and we're ready to post charges. Again, if there's something that you didn't complete out of these 4 items we have listed, just don't select it. So maybe we did not complete the prophy today. We just did an FMX and a comp exam. So I have the 3 items that we do want to post. I would then go to my options menu and hit post selected items. If you open this screen and you see everything is there, just how you want to post it, you don't have to pre-select these items and then hit post selected. Just go ahead and click post all. I would probably get in the habit of selecting the items first if you're just starting out doing this, and then using the post selected, just so you're consciously making yourself look through those charges before you send them to the patient's ledger. Now, before I post this, I do want to point out one thing at the bottom of the screen. You will not always get this box. This box states the procedure amounts entered are different than the fee schedule amounts. Choose the amount you want to use. So what that's saying is I manually entered a fee for these items versus allowing the fee schedule that's attached to that patient to automatically populate those charges. So I have the option to say I want to use the fee schedule, or I want to use the amounts I entered. And you can just click on whichever one is applicable in that case. I'm going to leave it with our fee schedule amounts. And I'm going to go ahead and post our selected items. Once I hit post selected, it actually takes us directly to that patient's ledger. And we can see the charges here, a D0150 for $40, D0210 or FMX for $100. And then our oral hygiene instruction we did for free as a courtesy to the patient. Keep in mind that once you're here on the ledger, if there's something that you realize, they just told me they also did a PA, or obviously in this case that wouldn't apply since we did an FMX, but let's say they added in a fluoride treatment. What we can do is go to our options menu and directly add a new transaction to the ledger, or we can post from their treatment plan. If I click post from treatment plan, we find that prophy is still sitting in their treatment plan because I didn't delete it. And again, that's assuming we're going to complete a prophy down the road in the future. I can use my back button or hit do not post to go back to the previous screen, and then click new transaction and just manually type in my 1206 or 1208 fluoride code and save my changes. So now I've got my fluoride that I've added on the fly directly to the ledger. A lot of offices do check out the patient from the scheduler because the front desk is typically handling those charges. But next I want to show you how to do it from the chart screen if the back office is going to start to take that responsibility on. A lot of doctors are starting to change to the mindset of posting charges themselves, because they know what they did that day, and officially it's their rear ends on the line if something gets posted incorrectly. And so because our chart screen requires you to not have to know the codes, it makes it easy for the doctors to jump in and start posting. So that's what we're going to do next. I'm going to go ahead and get out of Channing Tatum, and we'll go ahead and pick on Sandra Bullock now. So once I left click on her appointment, I can go to her chart a couple ways. I can either right click for options and go to view chart. I can go to my options menu and click view chart from here, or just jump to the top toolbar and click on chart, which happens to be my favorite way to get there. Okay. From the charting screen, you can see the transactions here that we have planned to complete today. I know that they're planned to complete today because under date, I have today's date. Those are also planned items. They state that here in the status, and all of these items are red in color, and our planned items in the chart screen are red. Okay, so once you have a treatment plan for things here, if you're ready to post your charges for today, you can go right to the options menu here and click post transactions. The next steps we see are very similar to checking the patient out from the schedule. The only difference is this is someone who's familiar with the chart, and you're going to do it from there. So once again, I select what items we did complete today. I have the option to edit any transaction, add another transaction, delete any transactions, and then just hit my post selected button. Once I post those charges, it actually takes me back to the chart screen instead of walking me to the patient's ledger, assuming that the front desk is going to do the money collection portion of the patient's walkthrough. So down here at the bottom in blue, we now have our completed items. If we go up to ledger we can open the ledger and just see that those charges are listed here, once again, as completed. You have a couple other options as far as posting charges on the chart screen. So if I look down here at the bottom, I can see that I did have items still planned that we did not complete. If it's already a planned item, the best way to post those charges is to go to Post Transactions. Some of you may be asking, what if it's not a planned item? So let's say today we did do a comprehensive exam, a prophy, and a pano x-ray, but we also took a couple PAs. We don't have any PAs treatment planned here. So instead of treatment planning it and then posting it, which is an option, I'm just going to go ahead and change my entry mode here to completed. Go to my options menu here under preventative and diagnostic and find the PA button. Click on that and click anywhere in the mouth. That item then goes in directly as a completed item for today's date. So the only time you want to use your entry mode of completed is if there's something there that was not previously treatment planned that you did complete today. And if we go up to the ledger, once again, we'll be able to find that PA directly on the ledger. I'm going to pause here just for a moment and see if there's any questions from you guys out there in the audience. Got it. So there is a question that asks, what about the billing? So we do have billing numbers in our software, and I'll explain that in just a minute. The secondary question to that is, when should the billing be created, and how will doctors know which billing they should select? So very good question. Thanks for asking. I'm going to jump up to the ledger to further explain what a billing is. And this is something that a lot of dental professionals are not familiar with, but if you have any medical experience, they use this billing concept in the medical world all the time. So when you have an insurance company that the patient is using or you're submitting claims to, that insurance plan or company is listed at the top of their ledger under billing information. So that is essentially who you're billing for these charges. If I uncheck this box, show all recent and open billings, I'm actually going to see that there's a billing number associated with that insurance and with different charges down here. If I click the little drop down, I am able to see there are different billing numbers, and I'm able to select those and jump to them. Now in this case, I have two billing numbers for Sandra Bullock. It turns out that both of those billing numbers are tied to Delta Dental of Arizona. The purpose for this is that our software is able to retain the history or the memory of what insurance company the patient had in the past. So as they change insurances, you want to open a new billing for the patient so that the new charges are attached to the new billing and the new insurance is attached to the new billing. That's what ensures that the proper insurance and the proper fee schedules get billed out for today's charges. So I know in our insurance webinar, we talked about that just a little bit. And so some of you might have been on that webinar with us. And if any of you want a copy of that webinar and didn't receive it yet, please let me know. Again, feel free to email me, Alicia, ALICIA, @dentimax.com, and I'll send that over. So the purpose of the billing is to be able to segregate who you're billing at what time for the patient. We're going to circle around to answer the full question here, but to lay out another example of different billings for a patient, sometimes you have a patient that comes in and they broke a tooth because at work they fell down and they chipped it on the corner of a table. Okay, ouch. So essentially that tooth, that procedure, whatever you do to fix it, is going to go to workers' comp. However, the patient may also have Delta Dental of Arizona for their regular insurance and still come in to have their regular cleanings. Workers' comp is not going to pay for their regular cleanings because they chipped a tooth. Okay, so we have two different entities that we need to bill for that patient. So that's a perfect example of when you might have a second billing outside of just when the insurance changes for the patient. Okay, the computer system will automatically create new billings depending on the setting you have it on. In this case, I did have the computer to create two separate billings for me because I added the PA on separately. Essentially, the front desk is responsible for setting up those billings for the patient so that the charges get posted directly to the insurance company or to the billing information you want to send that item to. The doctor can go ahead and just post the charges, and the front desk is able to manipulate the charge if it did end up on the wrong billing. However, if we go back to the chart here for a moment and you go to post transactions once again, you do see that there is an option to choose what billing number those charges are going to. You can add a description to the billing, and again, this might be the front desk's job to take care of. So if I click on this little magnifying glass, it's going to open up the list of billings for us. And sorry, let me actually pay attention. This is billing number 738. So I'm going to go here and type in 738. And I can see those two billings that I opened for the patient. I'm able to edit that billing and label it. We can just pretend for the sake of example, this is the workers' comp billing for the patient. Save our changes, and then 739 can be standard insurance, and save our changes on that. And we can go back here, and if the doctor is not sure which billing he should select, if the front desk has added a description for those two, that will help clarify the doctor his thinking. Is this a workers' comp issue that I did today, or is this a standard insurance issue as far as the procedures performed today? Outside of that, the computer will automatically pick the most recent billing to post those charges to unless you choose otherwise. So I hope that answers the question. Again, if the front desk does see that the doctor added those charges to the wrong billing, let's say this PA is supposed to go with the other items, I can double click this charge to edit it, and up here at the top of the screen I'm able to select what billing I want that item attached to, save my changes, and now I can toggle back to billing 738, and now they're all on one ledger or billing essentially. Keep in mind too that the computer will create claims based on the different billings. So if one item is on one billing and the others are on the other billing, we'll essentially end up with two separate claims for that patient because the computer thinks we're billing two separate entities. So sometimes if you run into that and you're wondering, why do I have two separate claims? That could be the case. And just to clarify or solidify this point just a little bit further, you can customize your screen here on the ledger if you want to see what charges are associated with what billing. I just right-click anywhere here and go to Customize View, and I'm able to add the billing number from the left to the right. And now that billing number is going to be displayed here next to all of the charges. So that's something that you may want to do in your offices as well. Great questions. That is a really tough concept for a lot of people. And so if you have any follow-up questions to that, please don't hesitate to get with me via email and let me know how we can help you further. Okay, so that concludes the portion of posting charges from the chart versus the schedule. And again, no matter where you post them from, as long as they say completed, they're going to show up on the patient's ledger. So our next topic is customizing the chart screen. The options menu should come with a default set of mini menus and also a default set of buttons inside the menu. You might find that some of the buttons in here are not relevant to anything that you do. Keep in mind that if it is something that you would normally chart as an existing restoration, even though you don't do that procedure in your office, you may want to keep the button in the system just so that you can chart it as existing for that patient. If you don't chart it as existing and it's not a button or a procedure that you do, you can go ahead and remove the button. So to customize a menu, I select the menu I want to customize, and then I just right-click anywhere inside the menu. I can add a code, which is essentially adding a button, change an existing button, or remove a button, and these all say codes. These buttons are all attached to a specific procedure code in the software. If you can make a code for something, you can make it a button. So a lot of doctors ask me, can I add a button for the toothpaste that I sell? Yes, absolutely. Just make sure you have a code for it in your program, and then you can add that as a button. If we look down just a little bit further, we can add a menu, rename the menu that we're in, or remove the menu that we're in. Customizing the menus is really nice because sometimes there might be different doctors in the office, and one doctor likes his buttons a certain way, another doctor likes his buttons totally different way. So you can actually create different menus for each of the doctors for the buttons they use most commonly. Keep in mind, the options menu itself is just this big blue space here on the left, and there's lots of stuff in it already, so you probably don't want to duplicate everything if you are going to do that per doctor. I would keep it pretty short and simple, and then have kind of a main menu for the rest of the items if that's something you're looking at doing. Now the next thing down is increase size. You'll notice that some of these buttons here are cut off and you can't quite see them all the way. If I click increase size, it actually just expands the size of that menu. And I just keep right clicking and it increases it a little chunk at a time. Decrease size obviously is going to take away some of the extra space I've got there. So just want to point out, I do have a multi-code menu here at the top of my screen, and that is because you can actually create buttons for the multi-codes that you have in your system. If you're not using multi-codes yet, I highly suggest looking into it. That's basically combinations of different codes put together in a nice little package, and it really helps you chart things very quickly and efficiently. So I'm going to go ahead and select that menu, and I've got a few buttons in here. This first one is representing a PFG crown with a buildup and seat. So there's 3 procedures inside that one. The adult prophy is adult prophy with 4 bite wings and a periodic exam. Then I have a recall for child prophy, 2 bite wings, exam, and fluoride. This limited LE, limited exam, it says emergency exam. In my software, emergency exam has a limited exam and a PA attached to that. And so I'm going to add a new button here, and to do that I just right click, add a code, and because I'm adding a multi-code instead of one individual code, I skip that first code section and go right to multi-code. Down here at the bottom I have all of my multi-codes, and so I'm going to choose implant with abutment and crown. Once I hit enter or tab, it actually fills in the hint. The hint is based on the description of that multi-code. You can change the hint if you find that it's a little long and you just want it to say implant sequence or something to that effect. Feel free to do so. You can also clarify the crown might be a PFG crown, and you might have different implant sequences with different types of implant crowns attached to it. And then I want to choose a picture for this multi-code. So I just click on the picture. It opens up my menu to select what picture I'd like. And for an implant with an abutment and a crown, I tend to gravitate towards these pictures in this section all the way through here. To select a picture, all I have to do is double click on it. So I'm going to go with our little light purple or pinkish picture there. Kind of looks like a crown is getting seated on a metal piece, which I would think of as an abutment, and we'll save our changes. Once I hit save, I now have a button to use that says implant with abutment and PFG crown. Okay, so that is how you add a button for a multi-code. If you want to add a regular button, for example, I can go to preventative and diagnostic menu. And let's say I want to add in, I think I mostly have everything here, but let's just go with comp exam. So if I right click inside this menu, once again I click add a code, and then instead of choosing a multi-code, I'm going to choose an individual code. So click your little drop down. You can type a D if it's a real billing code that you're going to use. and then just scroll to find the code that you like if you don't know it off the top of your head, which I'd suggest searching for the difficult codes ahead of time and knowing that specific code instead of just scrolling through the whole menu. Once I hit enter or tab, it fills in the description of that code under the hint. So I'm going to take out all of that and just put in comp exam to keep it short and simple. Now that's what I'm going to see when I hover over the button. And then once again, I click on the picture here to choose a picture that best represents a comp exam. And perhaps I choose NP for new patient, and I double click on that and save my changes. So now we've got a button in that menu that we've added. If you'd like to remove a button, all you have to do is right click on the button itself and hit remove code. And then again, if you want to remove a menu, select the menu or have it pulled up so it's expanded, right click and remove this menu. I'm not going to do that because it's a lot of work to put them back in. If you don't like the description of the menu, for example, restorative/pedo, let's say you don't do or see children, we can click rename this menu and take out the /pedo portion of this and click the OK button. So now we just have a restorative menu. One of the things that I've seen happen pretty frequently when people start to customize these buttons is they think that they need to have a button for each specific procedure code. For example, composite fillings have about 8 different codes that you could use for that based on whether or not it's an anterior tooth or a posterior tooth and how many surfaces of the filling you're performing. In our software, all of those resin composite codes are linked together, which means I don't need to have 8 different resin composite codes. I just need to have one code that says resin-based composite or composite, however you'd like to say it. Click the button and then click on the surfaces of the tooth I'd like to apply that to. Keep in mind I'm adding this in as a completed item directly to the patient's chart. So I have a number 5 distal filling, and the code on that is a 2391. I'm going to click a second surface here, and now I've added occlusal filling, and the computer's already corrected the code for me to a 2392. Then I click another surface, and now we have a 3-surface filling, a D2393. So the magic is you don't have to know the specific codes, you just have to know what procedure you performed and what button to pick in order to apply that procedure to the surfaces of the teeth. If I do a 1-surface anterior filling, let's just say the incisal of number 9, the computer chooses the anterior code, and it is a 1-surface code versus the 3-surface code, number 9 incisal. So the trick is make sure the composite code that you have attached to the button, if I right click and select change code, you'll be able to see that, is the smallest code in that sequence possible. So if you add a 1-surface code, you can always go up from 1 and just select the additional surfaces. If you add a 4-surface code, it's harder to go down from there, from 4 to 3 to 2. So always start with the smallest one, and then you can apply it additionally where you need to. Okay, looks like we have a couple questions here, so bear with me just a moment, and I'm going to run through those for you guys. Okay, so one of the questions we have, and I'm going to try and make sure I understand it, is if the plan items are scheduled over 3 appointments, and on the first appointment not all services are posted, now the one which is not posted, will it be moved to the next appointment assuming all procedures need to be going in sequence? Okay, so that's a really great question. Essentially, if you plan to do a sequence of appointments, whichever ones you do not post will still stay in the order in which they were originally planned. You just have to attach it to the next appointment. It doesn't automatically change its order. It's just still in the computer under the original order that you put it in. Some of you may not know exactly what that means, so I'm just going to do a quick example here in our software. I'm going to change my entry mode to planned. And now I'm going to treatment plan a few items for the patient. Let's go ahead and mark a missing teeth. Missing teeth are under our condition menu because it's a condition of the mouth. That's our missing tooth button right there. So I click on that and I'm going to say, let's say number 7 is missing. Now I want a treatment plan, so my entry mode says planned, and I'm going to plan to do that multi-code for the implant, abutment, and crown. I click the button, I click where the tooth would be, and we're going to have a picture or a drawing attached for implant, abutment, and crown. So those multi-codes are really handy. Once again, I've got implant, abutment, crown, and then seating of the crown. I want to put this treatment plan in order for the front desk so they don't have to ask me, what do I schedule first? So what I do is click on the item I want and then type a 1 on my keyboard, and under order, that item is the first order of business. Then I'm going to select these 2 items, and I can select multiples by holding my control button down and type a 2. And then seating the crown is going to be appointment 3. So if I just post, let's say in this example, these 2 charges here, or we just completed one of them, the other item will still stay in the computer under appointment or order number 2. And when the front desk goes to schedule, they'll still see that there's a 2 and a 3. As you post the charges, it does not change the order number. It keeps it as it was. So if there's no 1s, go to 2. If there's no 2s, go to 3. So that's basically how you're going to look at that. Okay, so one of the points that somebody has made is that when you increase the size of one menu, it actually increases the size for each subsequent menu that you select. That is true. Something that we can look at changing in the future if you'd like them to collapse to the size that you set them as and not have extra space in some and not enough space in others. So that's definitely something that we can look at changing, and I'd be happy to pass that along. Thanks so much for pointing that out. Currently, there's another question, is there a better way to just increase the size of one menu and decrease the others? There's not. Once you increase the size of one menu, it does increase for all of them, or decrease for all of them, depending on which direction you go. Again, that's something that we can add to our list and have a look at later. I'm going to go ahead and continue with our charting here. Just to give an explanation of the chart screen, if you are newer to the program and you'd like to kind of have the full layout explained, we're not going to go through every single one of these options, but at least give you enough information where you can start utilizing the chart screen. I want to explain at the bottom of the screen, this second half, you actually see all of the codes that are applied to the top half of the screen on your odontogram. Sometimes you might find that you see a code on the bottom, but you don't see any drawing up on the top. There are certain codes that you don't necessarily need to see a drawing for. For example, for bite wings, that's not necessarily something you want to see a picture on the teeth for. However, if you do have our DentiMax imaging, that does link into our DentiMax charting screen, and you will have a black number or a circle there that will show you how many x-rays that you do have on that tooth. So for x-rays, I just want to point out that you do have the option to see how many per tooth you have. Other codes, such as adult prophy, we don't necessarily want to draw all over their mouth because we clean their whole mouth. So there are certain codes that are just set up by default to not have a displayed picture. There are other codes that you might use that are not the most common codes used, that don't have a picture by default, and you may want to add a picture to those. So if you do see the code at the bottom, but again don't see a picture at the top for that code, that just means there's no drawing attached to the procedure code that you're using. If you would like there to be a drawing, you just need to know what code you want to modify. I'm just going to pull one up, for example. There's several different types of bridge codes that you may use for an abutment or a pontic, and some of those may not have drawings attached. So I'm going to right click here, add a code, and then pull up our bridge codes under the 6000s. Just choose one kind of at random. Let's say a titanium pontic. That's not very common, so there's probably not a drawing attached to that procedure. Okay. And I'm just going to leave it with this crazy blue tooth. And if I want to treatment plan that code, I click on the button and then click on a tooth. Oh, surprisingly, there was a drawing attached to that. I thought for sure there wouldn't be. Let's say we want to change that drawing, or there's not a drawing. You do see the code down here at the bottom, and it's a D6214. So what I'm going to do is go to my list menu, go to my service code list, and punch in D6214. Then we can click Edit Service Code from the Options menu. Go to the Charting tab, and down here at the bottom of the Charting tab is where we have your draw types. The draw type is what's telling the computer, put this picture on that tooth. So we've got a number of different options. We have a none draw type, which is what some of the codes you may find are set to none. We have the implant draw type, which is the little screw that we saw. Some of these are going to be very obvious. Root canal is putting lines through the center of the tooth on the roots. Arrow towards the mesial, arrow towards the distal, circle the root of the tooth, highlight the tooth number in the appropriate color. Hypersensitive line just puts a couple of diagonal lines outside of the circumference of the tooth. Recession will just be a line at the bottom of the tooth. Open contact mesial puts a little triangle by the mesial surface of the tooth, and distal does the same thing by the distal surface. Circle occlusal. Vertical lines is just going to put vertical lines through the whole tooth. There's actually 2 vertical lines that show up through the whole tooth. Crown is going to cover the whole tooth with a drawing. S literally puts an S on the tooth like a sealant would be. Half root canal looks the same as a root canal, but it's half the length, so it'll be a short root canal. Denture actually marks lines horizontally through the whole arch of that mouth. Bridge is going to be displayed and show that tooth as missing, so the tooth will disappear from the drawing as soon as you choose bridge. And then X puts an X over the tooth. You've got a hide tooth option, and veneer just does a little half arch over the facial surface of the tooth. Okay, so there are some secondary options. So if I click crown, we get different brush styles that we can apply to that crown. So it's going to cover the whole surface of the tooth, all surfaces there. It could be solidly filled in. It could have horizontal lines, vertical lines, diagonal lines, cross lines, or diagonal cross lines. So you're able to choose a different type of drawing. Right now, this code was solidly filled in for titanium. That, in my mind, makes sense, but maybe you want it to have horizontal lines instead. So we can change the brush style on that, save our changes, and then go back to our charting screen, and we'll see that tooth display change for us. So that's how you can attach a drawing to a tooth, or a button rather, or a procedure code if you'd like to think of it that way. Is there a way to have the color of the drawing individual based on the code instead of the entire treatment like planned or completed? And that is a really good question. So right now, the charting screen is customized or set based on the colors that we have here next to each item. So planned items are red, completed items are blue, and other doctor items I have as lime green. You can customize those colors based on each computer in the office and what you'd like to see. Obviously, I'd probably stick with what the doctor prefers in each operatory so that he or she doesn't walk in and kind of go, what does fuchsia mean? So the question is, are you able to change it on the code level instead of just the category of other doctor? The answer to that is yes. So perhaps there's certain items in the system, if I'm treatment planning, that I want to stand out as a certain color. If that's the case, I'm going to change the planned color to this black color with the D in it. And that means go based on the description of the actual code. So then what I'd have to do is customize each of my codes. So let's just pick on this tooth number 7 for a minute, and that procedure code is going to be a D6059 for abutment supported porcelain fused to metal. So I'm going to pull up that code under my service code menu under list, service code list, type in D6059, and edit that code. Once I hit edit, I can go to the charting screen once again, or charting tab rather, sorry. And then down here at the bottom, this is where I'm able to change the default color. So instead of having yellow, maybe that particular type of crown, I want to be, let's go with something exciting, teal. Save my changes, go back to my charting screen, and we're going to see that that color changes to teal. You are able to set that up per code, and then just keep in mind the bottom half of the screen. Obviously, you're not going to see a bunch of crazy colors down here, so the default color there is just going to be gray. I know in Canada, that's something that's pretty popular, is to have the colors set based on the severity of the procedure code instead of based on it being a planned item or a completed item. So you are able to customize that based on what you like. Very good question. I'm going to go ahead and change this planned item back to red, which is the traditional version. So we were able to put this treatment plan in order. A lot of people would ask, well, if number 7 is missing and I want to present a secondary option to the patient, instead of just having an implant, maybe they want a bridge. That's a really good point. Instead of adding the bridge to this same treatment plan, I would suggest opening up a new treatment plan for the patient. So if you click on the treatment plan tab, click new plan, it's going to open a second option up where there's nothing planned yet. Go back to the charting tab, and then you're able to start planning fresh. So under fixed and removable prosthetics, let's say we're going to apply the Pontic to number 7. We're going to apply the abutment crowns to number 6 and number 8. Okay, so now we have 6, 7, 8 is kind of bridged together. Again, if you don't like the drawing, because in this case I chose the bridge draw type attached to those codes, and you want to still see the tooth retained below, I would change the drawing to a crown on the abutment teeth instead of bridge as a draw type. So that is something you can go in and customize. You just have to know what code you're customizing. Okay. So now we have a bridge from 6 to 8 versus an implant on number 7. If I go to the treatment plan tab, I am able to go back to plan 1, and once it's blue, you know it's selected. Then I click load plan, and I can visually display that option versus 2, load the plan, and show the patient the secondary option. Once the patient does decide which treatment plan they're going with, you can select it so it's blue and hit set as default. That way, every time you open the chart screen, that's the treatment plan you're going to see for the patient. The other benefit to having these on 2 separate plan options is that when you go to treatment estimate to pull up that patient's estimate for those items, you are able to toggle between the 2 plans, and then you can easily print out each estimate separately. So the patient can have 2 papers and say, okay, this is my option 1, this is my option 2. The other thing the computer does is it calculates what the patient owes separately instead of having one big treatment plan and calculating it all as one option. So the patient's going to probably max out of their insurance if it's all part of one option, and the computer is not going to calculate what the patient owes properly versus having those on 2 totally separate treatment plans. So that's something there to just take note of. You can have as many treatment plan options as you'd like for a patient, and I would suggest not deleting the old ones if they're not chosen by the patient, so that you have a record in the system that you actually did offer the patient another plan, unless you're just going to store that inside the patient's document center as an option that you gave them, and then you could go ahead and delete a whole treatment plan. Otherwise, I'd keep it in there. So that brings us to another point. What if you make an offer to the patient and say, we can do an implant or a bridge, and the patient just declines to have anything done? You still want to know that you did offer them something in their charting, that you gave them an option, and also you don't want to keep trying to remember, did I talk about this already with the patient? Have we addressed that missing tooth? Did I give them options? So you want to keep those options in the computer, even if they decline to do any of them. However, you will notice in our view mode, we have an option that says declined. So if I click that, I'm going to view any items that the patient has declined already. And let's say we only want to look at our declined items and our treatment planned items. Okay. So let's go ahead and suppose that the patient declines the implant. Okay, so that means they can't have an abutment or an implant crown if they're not going to do an implant. I can select this item, so it's blue, right click, and then mark it declined. It asks me if I'm sure I want to decline the item. I say yes, and now it shows up as a declined item, and it's yellow, just like the declined color here is yellow. That way, if you want to see, I did offer the patient that option, just go ahead and pull up your declined items, and you see that it is there. If the patient later decides, you know what, I do want to go ahead and do that, you can actually double click this item, open it up, and change the status of it back to planned if you want to throw it back on their treatment plan. Okay. And so now we've got it right back there to do what you'd like with. Another scenario is the patient is going to do the implant, perhaps, but you're not going to do it. You're going to refer them out to another provider. Again, you want to have it in your records that you suggested and recommended that they do this treatment. So we do plan it, so it's on here as planned. Then you right-click and mark it referred out. Once you click referred out, you're able to choose what provider you're sending that patient to. Perhaps we're sending them to Dr. Jorgensen to perform the implant placement, and then you just click refer charges or think of this as your save button. Okay. And now if I pull up my referred out items, you're able to see that that item was suggested and it was referred out to another provider. If you're wondering what provider you sent it to, again, you can double click the item to open it up. And down here at the bottom, you're able to see referred to Nathan Jorgensen. On the date you referred it, and if we had a dollar value attached to that, you'll be able to see how much money or how much revenue you sent over to that provider that perhaps you could have done the treatment in your office and you chose not to. Okay, so we have a question, and basically, how do we actually refer the patient out to the other provider? Is there a referral, basically an internal referral that you do? And so I think really that question might be, do we have a referral slip, or how do we get that patient from point A to point B? A lot of doctors do have their own referral slips, and so you might have a stack in your office sitting there. If that's the case, you're going to want to fill one of those out for tooth number 7. And then I would scan in a copy into that patient's document center, and you could create a new category for referrals out in the document center and have a space to have those referral slips that you utilized. Another option would just be call the other provider and send them over. If you are using our patient portal or EHR, there is a way to electronically send over a referral to another provider. That's a whole nother topic, so if you do have the EHR system with the portal option, please shoot me an email if you need training on how to use the portal and get a referral out. If that's something that you're interested in and it's not something that you currently have, essentially the portal we have is a secure way to send emails. The government has deemed it secure to other providers, so it does follow HIPAA regulations. You are able to send any emails, any attachments that you would normally add to that, such as x-rays or an actual referral slip. You're able to have those all electronically go to the other provider as long as they have an email address they can receive those to. So again, for more information about that, please shoot me an email. We can talk about it further. I'd be happy to help you understand that a bit more. So we've done declined items, we've done referred out. As far as charting existing restorations go, that's going to be in your system under Other Doctor. So I can just select that to view in my view mode. And then if I'm going to actually chart existing restorations, I need to change my entry mode to completed by other. So that means either another doctor did it or it happened before you got the DentiMax software. In either case, you don't want to put it in as completed if you've done it, but you did it before you had the software. Completed actually is posting charges for today's date. It's not charting it as an existing restoration at that point. So we're going to use our entry mode and our view mode, go to our options menu, and let's say the patient has an existing root canal. Root canals fall under the endo-perio-surgery menu. So I click that, and when I hover over the buttons, they tell me all of the different procedures I have in my root canal menu. I'm just going to click the root canal button, apply it to number 31. And now we've got an existing root canal on tooth number 31. We can add one to 24 as well. And once again, I do want to point out the computer does change the code to the appropriate code based on the tooth and surface you've selected. Use the same buttons and menus in the system to chart existing restorations as you would to chart planned, as you would to use chart completed. So all you have to do is focus in on the entry mode. And if you're not viewing something, for example, planned items, if you don't have planned selected in your view mode, that is probably the reason why. I'm just going to pull everything in. And I want to explain conditions here lastly really quick. So those of you hanging on for the last few minutes, thanks for bearing with us here. So conditions are not something that you plan to do. They're not something that you've completed, and they're not existing restorations. Conditions are the reason why you plan something. They're the reason why you've completed something, or they're the reason why they had an existing restoration. So if you want to chart a condition in the system, I'd suggest selecting conditions in your view mode so you can see what you're doing. And just to eliminate some of the clutter, I'm only going to have conditions selected. And there is no entry mode for conditions, which means you can go right to the condition menu, find the condition you'd like to apply, for example, decay, select that button, and then apply it wherever there's decay in the mouth. Okay. Decay is not something you complete. You complete a procedure such as a filling because they have decay. That's why you don't have to pay attention to the entry mode. Some doctors don't chart the conditions, and that's fine. Other doctors really like to have in there that they have decay on that tooth, and then they treatment plan to do a filling to fix the decay. That way, if the patient calls 6 months later and says, "Why do you keep calling me to do this filling? I don't want to do it." The front desk can be educated and say, "Well, ma'am, the doctor has indicated that you have decay on that tooth. That means it's rotting away. We really need you to get that fixed, or you need you to get that fixed. Otherwise, you could end up with an abscess," and then go into all the benefits to fixing the decay in their mouth. So we've got a number of different conditions in here. Missing tooth, congenitally missing, unerupted tooth, decay, incipient caries. We have impacted distal, impacted mesial. We have abscess, a cracked tooth, fractured tooth. We've got open contact distal, open contact mesial, hypersensitive, recession, abrasion, and then a watch button. There might be other conditions that you want to track in the system. All of our condition codes start with a C. So if I go to my list and my service code list, if there's a condition I want to add to the system, I just want to make sure it's in the same sequence as the other ones that already exist. So my last condition code is a C0016. So it makes sense if I click New Service Code, I'm going to add in a C0017. Some people put in different perio classifications as a condition so that it's right there on their chart screen, and they don't have to open up the perio screen in order to look at that. So let's just go ahead and put in Class 2 perio. The type of code this is of course going to be a condition code. Once I select condition, I'm able to specify the treatment area for that code. In this case, maybe it's mouth, but perhaps you put it in under quadrant. Some doctors get really specific and put it under tooth. I would just say, keep in mind the treatment area is going to give you more or less opportunity for the different types of drawings that you might attach to that button if you're attaching a drawing to it based on what you select. So if you select tooth, you'll be able to use lots of buttons. Or draw types, if you select surface, you'll be able to use lots. If you select mouth, there's really no drawing for the whole mouth. So that's just an example to keep in mind. So we can go ahead and say the tooth has class 2 perio. And then under charting, we would attach a drawing if that's something you'd like to see on the odontogram. And maybe we just highlight that tooth number, save our changes. And once we have a code in the system, we can create a button for it. So under the condition menu, I'm going to right click, add a code, plug in our C0017 that we just created. The hint fills in for us, and then I click on image and choose a picture that's going to represent class 2 perio. Now, that's kind of perhaps a little obscure, so we might not find a drawing that specifically points that out, or we may. So here's perio 2. I'd probably use that one. Save our changes. Now if we want to apply that condition to tooth number 26, I click the button, click on 26. It's going to highlight that tooth number, and down here at the bottom we see class 2 perio for tooth number 26. Okay, I think we are about out of time for today, so I'm just going to check and see if there are any questions before we go. And again, we're doing a webinar once a month, so please check those emails and sign up for those. Even if you're not able to attend, keep in mind I do record those, and so you can absolutely request a copy of the recording at no charge. Okay, let's see. So someone asked, I assume the conditions are not really standard codes. Can we use diagnosis codes here as conditions? Yes, absolutely. You most definitely can. You can put in any code you'd like. Just keep in mind the type of code is the most important thing. It's governing how that code acts. So just put it in as a condition type, and you most definitely can use your diagnosis codes there. Great question. Okay, let's see. Next question is, if we mark a tooth as missing in the dental chart, will it also show up missing on the perio chart? Yes, it most definitely will. And so if we could just take a quick look at that, you guys can see tooth number 7 here is missing. So if I go to my options menu and just click new perio exam, you're going to see number 7 is gone. So always mark your missing teeth first before you dive into the perio chart. Okay, I'm just going to see if we've got a couple more questions here. Okay, looks like that's all the questions I've got. So if you guys are done for the day, feel free to hop off and shoot me an email if you'd like a copy of the video sent out to you. Otherwise, I'm going to stay on for just a couple more minutes and see if there's any other questions I can answer. And thank you guys so much for attending the webinar today. I really appreciate being able to give some extra training and help people understand the system better. So here to help you any way we can, just let us know.